The agenda this week assessed the COVID-19 vaccine rollout in Canada, debated free speech and democracy, and looked back at 2 decades since the human genome was first mapped. The agenda's week in review begins assessing what went wrong in long-term care in the province.
Once the virus gets into the home, and this is what matters the most, how do the for-profits handle it? And the rest of that paper outlines in black and white that they fail to control that outbreak. And that's what matters. Getting one outbreak, getting one case, that's an outbreak, is not the issue. It's how you manage it once it gets into the home. And they can't. They've had the deadliest outbreaks and the highest mortalities. And even the Stahl paper found that. So
can I just follow up with you on that? Let me just follow up with you on that. We know there have been outbreaks in lots of long-term care homes across the province. Once the outbreak hits, why would, in your view, the level of care in for-profit settings be any different from in not-for-profit settings?
Well, I'll tell you why, because it boils down to staffing. And that's also something that the Stahl paper didn't have. They don't have information on staffing because this sector refuses to publicly make that information available. Correction, the for-profit sector refuses to make that information publicly available. So we know, frankly, that ownership matters when it comes to staffing. Staffing matters when it comes to managing outbreaks. It is irrefutable that the for-profit homes hire less staff. They hire less full-time permanent staff. They pay their staff less, and they produce less hours of direct care per day. And you know why? You know how that impacts to resident care and the COVID outbreak? Because this is what happened. When the April 22nd directive came limiting employment to one home, what do you think happened? The workers at the for-profit homes left. They left for greener pastures. They left for places that paid them better and had better working conditions, period. And that was corroborated all throughout the testimony in various different testimony transcripts in the commission. So we know that. And then we saw in black and white, all of us saw this in real time, in addition to the testimonies, that what happened was that many of the for-profit homes were in a mad dash to find workers. Oftentimes, they threw workers without proper training onto the floor in the worst time, possibly, period. And what happened was negligible infection prevention and control mistakes were made that led directly to resident deaths. I mean, this is a very clear causal chain here. I mean, we have evidence, Sunnycrest, Tender Care, Roberta Place, ministry inspectors report showing clear negligence that resulted in increased death. We have leaked paramedic reports from St. George.
I hear you. Let me give Donna Duncan a chance to respond. Lots of stuff to respond to there. Donna, go ahead.
Yeah, certainly. And, we're going to agree to disagree with Dr. Vivian insofar as, our for-profit homes, our nonprofit homes, everybody struggled in this. As Andre Picard said, this wasn't a fair fight for anyone. If we look at the ownership of homes, the larger chains and private homes largely are for-profit homes because the nonprofit and charitable homes were rebuilt during the Harris government in 2000. The last time we had any significant movement, we have members of all ownerships who have made multiple applications to rebuild these homes over the last 20 years, and it hasn't happened. And
why not?
Yes.
Why has it not happened?
If we look back to 2007, when the Liberal government of the day made an announcement and a commitment to two things: aging in place and rebuilding these older homes. They moved forward in aging in place, but they didn't move forward on these homes, and we are seeing the consequences of that, and we need to move quickly. And I think the other thing I would say that. And just to echo Andre Picard, we're getting caught in a divisive, polarizing debate around ownership. We don't have the luxury of time for this. This is a very emotional debate. I know, I feel it. We've had tragic loss. But quite honestly, we need to mobilize to work towards solutions, to find our way through. We need to build a workforce. We need to work to build out that force of care. We need to rebuild these homes, and we need to find a way to rebuild confidence, rebuild the morale and the mental health and well-being of our residents. Because I don't think it's an overstatement to say that all of this fighting and this polarized activity is having devastating consequences on our existing workforce. And as much as our government has tried to attract people in, money's not going to help. Morale's going to help. And how we talk about this workforce and how we support the workforce and focus on the people who are living in these homes and working in these homes, we're not going to make sure, we're not going to have a system that's going to be able to support the care.
All right, let me get Pat Armstrong on this. Pat, do you believe that there is a difference in the quality of care and in the ability to fight COVID-19 between for-profit and not-for-profit long-term care homes?
Yes, I think we have considerable evidence to indicate that. Do I think it's the only factor right now? No, it's certainly not, but it's certainly a factor, I think, from all of the evidence we've had. And as I said earlier, we had evidence pre-COVID of more hospital transfers, more bed ulcers, higher mortality, for instance, in for-profit homes, a clear pattern. So, and the staffing levels, as Vivian pointed out, are absolutely critical. And not just the staffing levels, but the proportion of staff that's part-time. And that's true across all of the homes, but we know that that proportion is higher in the for-profit homes. We do have to increase the full-time staffing across the board in all of the homes. It's absolutely critical.
Carolyn, I wonder if you could help us understand the priority list right now, because obviously I've heard from lots of people who say, if you really want to make a dent in this thing, in COVID-19, go for congregate care settings first. So obviously long-term care, homeless shelters, prisons, that kind of thing, that's where the virus really loves to spread. On the other hand, you can imagine some people who pay taxes saying, wait a second, I pay taxes, I want to get ahead of all of that group of people. How do we resolve these competing interests here?
Yeah, so I think it's, the congregate settings is about risk, especially in long-term care. And, for better or worse, the decisions we made were not able to protect our long-term care populations. And so putting them at the very top of the priority list absolutely makes sense, because of both exposure and risk of a bad outcome given exposure. The same goes for the very elderly. But after that, what we're finding is it's not so much about who pays taxes, it's about who's at risk of being exposed and being a transmitter. And I think now that we know how powerful the vaccines can be against transmission, so preventing people from getting infected, and then if they're not infected, they can't infect their contacts, what that means is we have an opportunity to get the most bang for our buck of rare, relatively scarce vaccine doses by starting to prioritize essential workers, people who cannot distance at their work. They can't work from home. They have to work in essential services, frontline work, maybe teachers, firefighters, grocery store, food production. We've, of course, seen outbreaks in food processing. These are areas where actually with one vaccination, you can prevent more bad outcomes in those groups, because you prevent the bad outcome in the person you vaccinate, but also in a whole bunch of others who don't get infected because you stopped chains of transmission. So I think that's where the conversation should be turning after we finish vaccinating the very most vulnerable.
Isaac, can I get you on that? What should the priority list look like? In what order?
Yeah, great question. And clearly, there's some pretty heated debate on in media and in social media and in conversations, because everyone seems to have, and rightfully so, some very strong opinions on this. I think you can approach this through a data-driven lens. You can approach this through an equity lens. You can approach this through public health lenses. And of course, the Venn diagram of those lenses overlaps at some sweet spot. Yeah, I completely agree with Dr. Collane that there are strategic ways to vaccinate populations to get the most bang for the buck. I think we have to acknowledge who's at risk of death, who's at risk of having a serious outcome, and of course prioritize that. And that's equity and a public health and data-driven approach. Age is like by far the biggest risk factor, and we just can't ignore that. Now, there's a lot of risk factors for severe outcomes, but age stands above just about everything else. So we clearly have to vaccinate by age. But there's multiple right ways to do this. And for example, you've heard in Ontario, you can look at not just age, but for example, other social determinants of health that could help drive a very equitable and data-driven vaccine program. So if you look at something like postal codes, well, as it turns out, someone who's 50-year-old in certain postal codes has the same risk of dying as someone who's 80-year-old in another postal code. So if you really want to take a data-driven and equity-based approach, you can look at a variety of measures, a variety of mechanisms to vaccinate based on age, based on postal code, based on, and of course, a variety of other factors as well, like Dr. Collane mentioned, essential workers as well. So what you're going to see from coast to coast, well, I guess we're talking about Ontario. So what you're going to see in Ontario when the plan is hopefully released sooner rather than later, is that the second wave of vaccinations will be prioritizing people who are at greatest risk of having a severe outcome from the infection, but B, as Dr. Colleen puts it, people that are obviously at greater risk of getting this infection, but also of facilitating transmission in the community. And of course, that does include congregate settings as well.
In Canada, there is a certain feeling, I think, that the people have been almost convinced that if they speak their mind, not even particularly offensively so, they could be in trouble. I don't think that's the reality generally. Now, there are excesses, as I mentioned earlier. I've seen them, but I'm an aberration in many ways, in that I went back to university 5 years ago as an old person. And for 4 years, I saw various colleges at the University of Toronto. I have to tell you, very little had changed. The kids were probably nicer than when I originally went to university. They worked harder. But free speech didn't seem to be a major issue. People were still expressing themselves. But I would agree there is a feeling out there that if I speak my mind, I'll get in trouble.
Irshad, I wonder if you could follow up and bring into it the American point of view as well, because you've obviously lived in the States for some time. A recent survey in the U.S. suggested 62% of Americans are afraid to share their political views. Do you notice a difference between the two countries on either side of the border on this front?
Not in the sense of fear. People do live with fear today. Some are resentful about it. Some have simply resigned themselves to it. And, we talked just briefly moments ago about social media. Obviously, given that, one tweet could mean not just character assassination, but frankly, the loss of your job, and certainly the elimination of a healthy reputation up until that point. People do worry about what's going to come out of their mouths. And the other point to make about all of this is that we are living in a time of very low social trust, by which I mean not just trust between citizens and government, but frankly, trust between and among people. People generally believe that if we are going to say anything that's going to tweak somebody else's nose, even inadvertently, that discussion will instantly become a debate. And I have seen, Steve, with my own eyes and with my own ears, have heard people don't feel comfortable with debate. Only the loudest, most extreme voices go after debate. They foment it. But everybody else who's basically more interested in solutions and getting on with their day than in, bogging themselves down with their egos, most people actually fear having discussions turned into debates, and therefore will think twice before even launching a discussion about something that could be complicated enough to warrant a debate.
Sheree, what do you think it says about the state of free speech in Canada when apparently fewer than 1 in 5 of us feels comfortable expressing their views in public?
Some of that could also, I would like to see how that would compare to maybe 5 or 10 years ago, because a lot of people are simply not comfortable being open in public, whether it is because of the pushback they're going to get or whether it's just self-consciousness. To some level, I think this is also about self-censorship. And self-censorship is not necessarily a bad thing if it means that you are about to say something that could be bigoted, racist, misogynistic, and you are stopping yourself to self-reflect upon it. So that's not such a bad thing. A little bit of self-reflection and thinking through consequences is a good thing. If we are talking in terms of debate, I have to agree with Irshad that I don't even believe debate is the best way to solve these problems, because a debate is not necessarily a place of trust where you don't begin with any kind of a common ground. Whereas on a person-to-person interaction level, yes, you have a certain maybe relationship and you can begin with that. Social media may not be the best place, but often that's where a lot of pushback happens, because especially if it is by traditionally marginalized people who've never had access to those so-called debates or discussions. And this is one place that they had that access, and they're using that access point to push back. And in return, what would be nice is if people who have never been challenged before stop to listen and ask why. Why is it that somebody is pushing back? Is what they're saying actually not right?
I'm talking about things that are just sort of like, ordinary, everyday, politically incorrect things. And you say you're going to lose your job. Does that person who loses their job go home and say, wow, I really need to educate myself about intersectionality? This period of unemployment is a great time to watch some videos by Robin DiAngelo. Thank you. Thank you for giving me this period of reflection. No, of course not. They're going to become more vested in whatever ideological vector took them to, and it may have been no ideology. I mean, sometimes people just say casually intolerant stuff.
July 7, 2000. Go.
That was definitely the highlight of my life. We were racing like crazy to get the genome done and out there. And at that moment, I had to look back and say, here is a long sequence of A's, C's, T's, and G's. As a computer scientist, as Aravinda was saying, it's just information. But in fact, it represents the struggles and the triumphs of our ancestors since the dawn of time. I mean, this is the message that has been passed on like the Olympic torch from parent to offspring for so many millennia. And now it comes to us, our script that was forged by our ancestors. And at that moment, I realized that we had put it together. 20 different centers from around the world had been cranking out sequence like crazy as fast as they could in anticipation of the announcement at the White House on June 26th that the first draft was complete. But that draft had not actually been shared with anybody. And because we did the computational part of assembling all of the pieces in this mad rush to get it ready for the White House ceremony, we had the honor of posting it on the internet. And again, like Aravinda said, there are two great technologies of the late 20th century, which are molecular biology and bioengineering and computer science. And they came together in that moment. We posted that first draft on the internet, and now our genome was copied at the speed of light, spread around all of the planet in a very non-biological way.
Let me just jump in with a quick follow-up there.
Heritage.
Why'd you put it up on the internet?
Oh, this is a matter of principle, really. Our competition was making it available only by subscription and claiming intellectual property on it. And we felt that that was inappropriate for that information that is so fundamental to humans. So we put it on the internet free without any restrictions on use and no claims of intellectual property.
And Shirley, when the news eventually got out, for you, what were some of the biggest surprises in terms of discovery?
Well, I think the biggest surprise was how few genes we actually have as human beings. I had been teaching for years that the human genome probably had something on the order of 100,000 genes. But when we were able to look at David's ensemble and begin to count up the number of genes, it was shocking that the number is probably in the order of about 22,000, not 100,000. And this was a humbling moment because, after all, we knew how many genes there were in these other organisms that we'd sequenced, and it wasn't that many fewer genes. So suddenly we had to contend with this huge, I think, philosophical dilemma, which is, how do you make something as complicated as a human being with so little apparent information?
Yeah, Aravinda, I wonder if you could follow up on that, in as much as I guess we discovered that we don't have very many more genes than a worm. What should we infer from that?
Well, I think that says that we have looked at the biological world in a very different and biased way. it says nothing about our genome. It says something about what we believe. An interesting thing is at a meeting in Cold Spring Harbor, these were annual meetings, and on the Genome Project the year before the genome was fully assembled, there was what should I say? There was a competition, if you will. There was a poll to see who could estimate the correct number of human genes. And just as Shirley mentioned, the estimates varied all over the place, but most of them were at the high end. I think the fact that we have 20,000 odd genes says that we need to figure out exactly how a human being can be made and is made, not can be made, is made from 20,000 genes. What is it about the rest of the genome that makes those 20,000 genes do all of the varied biology and physiology that we study?
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.